Sophia, Wickenden practical assessment 9, washing our hands. Best practice to remove your jewellery and watches. Wet your hands first before lathering. 5 moments for hand hygiene for this would be before and after touching a patient, before a clean or aseptic procedure, after body fluid exposure risk, and after touching a patient's surroundings. And you get a real good lather, intertwine your fingers and rub thumbs, fingernails. And wash thoroughly. Always remembering to pat dry, not rub, for skin integrity. Can then complete your hand care. This is important with a water-based moisturiser to prevent abrasions in the skin. Having no breaks in the skin is a natural defence to infection. And that is it. You are complete. Sophia, Wickenden practical assessment 9. This is our sterile supply area that we have on the wall here. Everything is pre-packaged. It comes to our treatment table here. And from here, as they're used, they are directly disposed into the bins underneath, which is a general waste bin there, and then there is a clinical waste sharps container. Sophia, Wickenden practical assessment 9. This is our other sterile area, which is our surgery area. You can't enter without a cap or a mask, as it says here. So the equipment that gets used gets removed by the surgery nurse. It then comes from there to here. This is our washing area. It will get soaked in the Metazyme in the sink before being moved to the Soniclean. From the Soniclean, it goes to the table to be dried. It will then be packed in pouches or packs. It will then go to the autoclave to be sterilised. It can then go to these baskets, and then it goes into our sterile supply cupboard here, which can be accessed from surgery or from treatment as needed. Sophia, Wickenden practical assessment 9. We are doing the cut simulation. I have a cat scratch on my hand, so we will do some first aid. First aid box is down here on the wall. Ideally, you would have someone else administering your first aid, but for the purposes of this video, we will disinfect the area. And then wash. Remove. And then you will place a waterproof dressing. And then, seeing as this is a cat scratch and there could be bacteria present, you would see a manager or senior staff member to fill out an incident report, and then see a doctor if required. Sophia, Wickenden practical assessment 9, safe sharps removal. So with our PPE, which is gloves, we take our sharps, we twist, it has already been recapped, we twist from the bottom to remove. And that directly goes into our sharps container. You would then dispose of, this is flush, so this will just go straight in the bin, and syringe in the bin, general waste.